I'm going to interview a fascinating lady called Marcel, who first came to see me 18 months ago as a patient in my clinic. Marcel was not in a good way when I first met her. She was very overweight and she suffered with severe chronic fatigue. So she'd come to me for help, and I think she probably said, "Oh, you're my last resort," which a lot of people say. But that didn't worry me, because after spending some time with Marcel, I could see that it was really not going to be a problem for her to lose weight and restore her health, because I was going to use the weight loss detective model of the jigsaw puzzle, looking for all the pieces that needed to be corrected, the things that had made Marcel unwell in the first place. So Marcel's going to tell us her story, which is very inspiring. And also we're going to look at the causes that were hidden there that were preventing Marcel from being successful with her weight loss. So, hi Marcel.
Hi Sandra.
Thanks for coming today.
Thank you for having me.
And you are looking great.
Thank you. Fabulous too.
Well, I've always been thin, but you haven't always looked like that.
No.
Yeah.
When I came to see you, I was 40 kilos heavier than I am today.
Yes.
And as you say, incredibly tired and incredibly run down and
Yes.
exhausted all the time.
Yes.
And I really had tried every kind of diet program and weight loss program, including lap band surgery.
Yes. Yeah.
That was probably the most extreme solution that I looked for.
Yes.
And I think the thing that really hit me, I remember that first appointment that I had with you, was the time that you took to understand my history. And while I had walked through the door expecting you to talk to me about weight loss, you actually spoke to me about what my hormonal history was. You were asking me all sorts of questions about the rest of my health,
Yes.
which was fantastic. And I think that made me realise that maybe there were other things contributing to why I'd been so overweight and become so unhealthy. So it started to unlock some doors for me.
Great. Well, you know, you're a typical example of somebody who had all these hidden causes of a disturbed metabolism.
Yes.
And you thought it was your willpower.
Yes.
And it wasn't your willpower. Your problem was you had a fatty liver, you were intolerant to gluten. We picked up that
Yes.
with the blood test, and you
big
didn't
one.
know.
No.
So gluten was making you overweight. You were on the contraceptive pill for way too long and you didn't really need it. So that was causing your blood sugar and insulin to be too high.
Yes.
You were working very long hours, which doesn't help obviously. You didn't have the time for exercise. And you were eating way too much carbohydrate. You weren't necessarily overeating, but because of your high insulin levels we picked up, you were craving carbohydrate. And so all these factors made it impossible for you to lose weight, even if you had a strong willpower. And it's probably the reason too why the lap band surgery didn't work for you.
Yes.
Yeah.
Yes. Because I think in many respects my story is very normal. My story is very much the story of so many people, is
Yes.
that you fall into a pattern of life and you think you're doing the right things, you think you're eating the right foods or the right combinations of foods, and probably working too many hours and not exercising enough, and you should change those things. But when you don't see any benefit out of that, when the results don't flow because you haven't addressed the underlying issues, you get really despondent.
Yes.
And then you think, well, this is just me and this is how I'm supposed to be, because I've
Yes.
always been overweight, even as a child.
Yeah.
And so people tell you, oh, well, it's just your body shape and it's just your body type and you can't change it. And so you start to believe that.
Yes.
So I think working with you helped me realise that maybe I could change some of these things and encouraged me to ask different questions.
When I first met you, I didn't know what body type you were because there was so much fat there. And now you're obviously an android. You build muscle easily.
Yes.
You've got good muscle definition. Your shape is nice, but it's predominantly athletic shape. And basically, when I saw you today, having not seen you for 6 months, is it?
Yes.
I didn't recognise you. I thought it was somebody else coming, and I said, "Oh, I wonder who this patient is. Maybe she's come to purchase a book or something." And I went, "Oh, it's Marcel! Wow, Fantastic.
I've had a lot of reactions like that, which has been really great.
Yeah.
And I still take myself, I still get sort of a second glance at times when I look at myself in the mirror, or I go shopping for clothes and I look at things on the rack and I think, oh, I can't wear that. And I think, oh, no, hang on, maybe now I can. So, it's been quite an adjustment in terms of my own image of myself as well.
Yes, and your self-esteem.
Yes.
And, the other interesting thing that I'd like to tell people about you is when you first came to see me, you were very overweight. But still, I look for nutritional deficiencies.
Yes.
And, a lot of doctors won't do that, or weight loss consultants either, because they think, well, that person's overweight, they're not going to have nutritional deficiencies. But we picked up a severe vitamin D deficiency, a very low level of the mineral iodine in you, and we picked up
low iron. Incredibly low iron.
Yeah, and that's because you were gluten intolerant,
yes,
which reduced your absorption of iron, and therefore you were tired and didn't feel like exercising.
Yes.
So you can see how one deficiency will perpetuate another problem.
Yes.
And so that's why it's like a jigsaw puzzle. You've got to find, okay, iron deficiency, gluten intolerant, been on the pill for too long, caused a fatty liver, all these things. So we picked up the low iodine, the low vitamin D, the low iron, and then we treated those deficiencies, and that helped your thyroid gland.
Absolutely.
Yeah.
And I lost, and the funny thing about the gluten intolerance was I didn't believe in gluten intolerance.
Well, you're a nurse.
Yes.
Yeah, you're a nurse.
But I thought, oh no, this is just one of those fads. Everybody all of a sudden is gluten intolerant.
Yeah.
And but cutting gluten out of my diet, I lost 20 kilos within 3 to 6 months.
Yes.
Doing nothing else. I wasn't doing any exercise. I wasn't doing anything other than cutting gluten out of my diet and doing the supplements with iron and the thyroid support and the vitamin D support. And so it changed. It absolutely changed my body, and I felt so much better. And I realised in hindsight how unwell I'd been feeling for so long.
Yes.
Because I didn't realise that you could develop those intolerances, or that they would present later in life.
Yes.
I thought you were either gluten intolerant at the outset or not.
Oh, okay.
I didn't realise that some of those things can present through the course of your life. So
that's right.
It was a great discovery.
Yeah. Well, you have to be a detective to help people with a chronic weight problem. You have to look for everything. And I think the vast majority of people fail because all they look at is how much they're eating. We know diets don't work. 95% of people will fail long term on a diet. So you're the opposite to the normal, what's happened, and you're so inspiring because, the average person will go, well, I've tried all that and it didn't work. But, because I looked for the hidden causes and we found everything, and then you believed in yourself and you persisted, that you've been successful. And also, when you gave up the gluten, you saw the difference. So your mindset of being a nurse, I've been educated that you've got to be a celiac to be gluten intolerant.
Yes.
So I couldn't be gluten intolerant, I'm not a celiac. But when you saw the results of giving up the gluten, you went, no, this is not a theory, this is really happening.
That's right.
And that's the difference, isn't it? You can have a theory and be academic, but you've got to try things. You've got to suck it and see. I love that saying. One of my favourite things. Well, I don't know, suck it and see. And if it works, it works.
What I've realised through the whole course of this, whether it's diet or exercise or the support of nutritionists, is I think for people who are overweight, you have to keep asking questions until you get the answers that work for you.
Yes.
Because it's not a matter of one set of rules fits all or one size fits all.
Yes.
And I think that's where it's been fantastic working with your team, because people have helped me people have worked with me to keep asking those questions until we found what worked for me.
Yes.
Because I think having a background in healthcare, I know so many people in that industry think, patients are just lazy, or they don't really follow the programs, or if they just ate less and moved more, that'd be it.
Yes.
Now, there's a lot of people out there who are actually eating too little and doing lots of exercise, but not getting any results.
Yes.
They're presenting to you every day.
Yes, that's right.
And they're getting really depressed about themselves because
Yes.
they don't see any change. So
Well,
you've got to keep asking those questions.
Yeah, you do. And like you've lost around 40 kilograms, which is nearly 100 pounds, you know, around 100 pounds. That's a lot of weight. And, you know, you still look fabulous. The thing is, you know, because you've done the exercise, and Vicky Jane will be going through that with you later on. And when you look back and, you know, you've tried everything, do you think the lap band helped you at all? Because a lot of people have lap band surgery, and some people do get results.
Yes, and I respect that. I think for some people it works and it's a good solution. It didn't really work for me.
No.
What I would say is I dropped weight with the lap band, but I couldn't sustain that because I wasn't eating. I wasn't eating properly. I wasn't eating a good balance of nutrition, so I was actually malnourished.
Yes.
Because I wasn't able to eat breads, I wasn't able to eat rice. There were a whole range of foods that I couldn't eat and that I then got scared about eating because the food would get stuck and I'd get uncomfortable, and then there was managing the whole social situation of that. So it was, from a lifestyle perspective, for me, it didn't work. And from a diet and nutrition perspective, it didn't work.
Yes.
So I no longer use that. But because I've been able to change my diet and my exercise and get the results with that, I think it's a much more sustainable result for me long term.
Yes.
And it's a much more sustainable lifestyle that I've now got in place.
Yes. So you feel that you'll be successful in the long term. You're absolutely confident.
Yes. So whereas with the lap band, I was thinking, I can't keep living on milkshakes and coffee until I'm 80. That's not going to work. So I needed to keep looking for another solution. So while I got an initial result, I couldn't sustain it, and I actually put 90% of the weight back on.
Wow.
When I took the lap band effect off.
Yes.
You know, I just went straight back to pretty much where I'd started from, because I hadn't changed anything else. I hadn't changed my diet, I hadn't changed my exercise, I hadn't changed my mindset.
You hadn't changed your mindset. The mind thing is super important. You've got to believe that you're going to be successful and you don't give up.
Yes.
Yes.
Well, that's where a team helps.
Yeah, you have to have a team. Well, the weight loss detectives are a great team. They're very knowledgeable, they're very caring, very supportive, and, you know, we never give up. Even when you do. But you're not going to give up, I can tell.
No, and the fact that, you know, I email you with questions, I ring, you know, just having people who are in your corner and come back with the right advice. And I found that with exercise too, you know, just having a team that you can draw on to help support you with that makes a huge difference.
Yes. Well, you know, it's very important that we picked up those nutritional deficiencies because, you know, the lack of vitamin D would have increased your risk of cancer, osteoporosis, and perhaps you were low in D also because you weren't eating enough fat.
Yes, which is the irony.
Yes. And then the low iodine, that increases your risk of thyroid cancer, breast cancer, and also thyroid dysfunction, so your metabolic rate's slower. So by pinpointing all those things, it's made it a lot easier for you. And by pinpointing the gluten, I think that's very important because so many people are intolerant to gluten and they don't realise it like you.
Yes. Yep. Yeah. I'm a convert now. I get it.
So, you know, it's just fantastic. And, you know, you were always a wonderful lady. You know, you had a great personality. But when I first met you, you were tired. You were very tired and overworked and down.
Yes.
And, you know, the transformation in you is gobsmacking, you know, mind-boggling. Just when I see you, I think, wow, that woman, she's healed herself so beautifully. And I just feel like I was an instrument in that process. I gave you the information. You believed in me enough to do what I told you, but you actually healed yourself. And you just look so wonderful. I think you're going to be inspiring for a lot of people.
Oh, thanks, Sandra. Well, I hope it inspires other people to think again, particularly if they've given up. You know, to think again and maybe give it another shot because it's absolutely worth it and it's never too late to change.
Never too late. No, never too late. Never give up.
And you get your life back, so why wouldn't you?
And by the way, you look 20 years younger.
Oh, thank you.
I have to find out what face cream you're using. Yeah. Well, thanks so much for coming in today.
Thanks, Sandra.
And sharing your story. We really appreciate that. That's a beautiful story and very personal. And you have to be brave I always say, to overcome the obstacles to good health, you have to be brave, and to share your story, you have to be brave.
Thanks, Sandra, and thanks for all of your help.